All right, folks, I'm going to kick us off for round two of our panel discussions. It's going to be the same process as you experienced in the first round. Let me start by welcoming you all. The topic for this breakout room is supporting students' basic needs. We'll talk a little bit about what's included that in a second. First, I will quickly introduce the topic of the panel and our presenter this morning, and then she will talk for about 20 minutes with a presentation about the work that the Hope Center does and that Carrie personally does, and then we'll have a few minutes for questions. And throughout the presentation, same thing, if you have any questions, feel free to ask them in the chat. We'll get to them probably at the close of the sessions because Carrie cannot answer and talk at the same time. So the topic for us is student basic needs. And we know from research that college students face major basic needs insecurities and that they're a major barrier to their degree attainment. So included in that is the lack of access to healthy food, safe housing, consistent transportation, and affordable childcare. Prior to the pandemic, students with lower incomes were enrolling in college at rates higher than their middle income peers. These students, which arguably stand to gain the most from a post-secondary education, often face the compounding barriers of systemic racism and declining college affordability, combined with stagnating wages and the rising cost of living, with profound racial and social inequality implications. The objective for our session today is to discuss efforts that are currently underway in Virginia and in other states to address these barriers to improve post-secondary outcomes and the strength of our future workforce. There's actually some live legislative developments that just took place this morning that are quite wonderful. So Carrie will talk about that. What the work entails in this case is partnerships between higher education, state agencies, and other partners, opportunities for policy alignment, and leveraging federal and state funding to bolster these efforts. Our presenter this morning is Carrie Welton. She's the Director of Policy and Advocacy at the Hope Center for College, Community, and Justice, located at Temple University in Philadelphia, but Carrie is a resident of Virginia. And her work, our presentation this morning focuses on Virginia. Carrie's career has focused on using evidence and research to improve federal and state policies that reduce basic needs and security of people with low incomes, including students of colors, parenting students, first generation, and immigrant students. Her efforts and perspective have been greatly informed by her own experiences as a low-income first generation college graduate. In her previous role at CLASP, Carrie established herself as a trusted public benefits policy expert, where she provided technical assistance to states to identify and implement policy changes that better support students and maximize federal and state funding streams. Her prior work experience includes 4 years at the Kellogg Foundation on the National Education and Learning team, as well as 4 years at the Kellogg Company on the organization's government relations team. She also spent 5 years on the state board of the SELU of Michigan, furthering civil liberties and civil rights of residents. Carrie has an undergraduate degree in public law from Western Michigan University and a Master of Public Administration degree from the Gerald Ford School of Public Policy at the University of Michigan. With that, thank you all for attending, and Carrie, take it away. Muted. All right, I see you muted.
Sorry, my cursor disappeared. I had no idea what happened there. So thank you very much, Teresa, and thank you all for your patience, and thanks for joining the session today. Let me just get my slides queued up. Let's see, and okay, can we see slides?
Yes.
Okay, great, thank you very much. So as Teresa mentioned, I'm Carrie Welton. The Hope Center for College, Community, and Justice is probably best known for our annual Real College survey of student basic needs and security. Today, I'm going to talk a little bit about that, and I'm also going to talk about our efforts overall to improve food insecurity in Virginia. So this includes an overview of the SNAP program. I'll do a little framing of that to just set the foundation. We'll talk about food insecurity in Virginia and college student basic needs insecurity, what that means, and then specifically this opportunity the case study we'll talk about today, as well as other opportunities we see in the Commonwealth for the future. Where is my button? There we go. Thank you. Okay, so this is a text heavy slide. I'm going to try to go slow and just set the foundation a little bit for what do we mean when we say poverty? In this country, poverty is defined using the federal poverty level. This is actually based on a formula from the 60s, which was based on a thrifty food plan, and that formula has not been updated except for a small cost of living increase each year. So when we talk about in poverty for a single parent with 2 kids, this means that they must make under $21,170 a year. So this is 100% of the federal poverty level. This is the point where they're actually in poverty. For a single student, in poverty means they make less than $12,760 annually. So once they make over these amounts, they're no longer considered in poverty by the federal government, even though eligibility for our public benefit programs are set as a percentage of this 100% of federal poverty. So in the SNAP program for this single parent with 2 children, the federal limit is 130% of poverty. And this means once they make over $27,732 annually, or $2,311 a month, they lose access to SNAP. They must stay under that income eligibility limit to access the program. And for that single person, at 130% of federal poverty, their income must stay below $16,588 or $1,382 monthly. Now, we know these amounts are incredibly low, and this is because the federal poverty level has not been updated to reflect current, living conditions, expenses, housing, all of the things that we know matter. Which is why we see such high rates of food insecurity, not only in the Commonwealth, but across the country. So food insecurity in Virginia prior to the pandemic was estimated to be about 850,000 Virginians, and this included 250,000 children. After the pandemic, we have added 445,000 Virginians who are experiencing food insecurity to this number, which is one of the reasons we chose to focus on the Supplemental Nutrition Assistance Program. So I'm going to talk through the SNAP program, formerly known as food stamps, a little bit so we get an understanding of what is SNAP eligibility and why does it matter, and particularly what is the benefit in this change that's been soon to be recently implemented. So the Supplemental Nutrition Assistance Program is the nation's largest, most effective food assistance program. It helps families experiencing financial hardship ensure they have a modest ability to meet their most basic need for food. Benefits are provided on an electronic card each month to eligible participants. And the benefit to states of SNAP is that it's almost completely federally funded, with states only contributing to the cost of administration. The other reason that SNAP is so important is because it's what we call an entitlement program. As opposed to TANF cash assistance and childcare subsidies, those are block grants, which means there's a set amount of funds and those programs don't expand with eligibility. SNAP is what we call countercyclical because it is an entitlement program. So that means in an economic downturn, when people have more need, SNAP expands and meets that need, so the program grows to meet it. As I mentioned before, SNAP has income and asset limits. So these are very text heavy boxes. I won't go through all of these. It's a little bit complicated. I will just say that you have to first meet income and asset limits. We'll talk about families, but we'll also talk about individuals generally, but we'll also talk a little bit about students. So students and everyone who tries to access SNAP have to meet income and asset limits. And these asset limits mean families are limited in the amounts they can save in their savings accounts, as well as the value of their vehicles, which prevents families from being able to access longer-term economic security. So these asset limits that you see here are at 130% of the federal poverty level, which is the federal limit on SNAP. And then household qualifications include if you live and prepare food together, you're considered a household for SNAP's purposes. If you, for example, live with a roommate and you buy and prepare food separately, you're considered a separate household for SNAP's purposes. Even though this almost always includes dependents, the age of 22 and under, and spouses, and there are different rules for senior citizens. The other thing that's important to note that combats this misnomer that undocumented immigrants come to this country and live on our benefits, which is completely false, is that you do have to meet citizenship requirements to be able to access the SNAP program and frankly, every federal public benefit program. This includes US citizens, lawfully present non-citizens, and there are some other exemptions that I won't go into here. What this actually means is it results in a monthly benefit amount that for an individual person at that 130% of poverty level, it means they could get a maximum of $190 a month, but the average is actually a lot closer to $130. And for a 3-person household, the maximum is up to $500 approximately. The average is actually closer to $378. So then when we talk about student basic needs and security, we talk about what a student has to meet all of those criteria in addition to being enrolled at least half time to meet a student exemption. The reason it's called a student exemption is because SNAP has a work requirement. It has for several decades, which also means that people cannot access SNAP long-term without having work. So that means a student who meets one of these exemption criteria is exempt from SNAP's work requirement. What that means is a student has to be enrolled at least half time, and then they can meet one of these exemptions to be able to meet the eligibility criteria for SNAP. And I'm just going to bring them all up. Now, this doesn't mean that students enrolled less than half time are not eligible for SNAP. All it means is that they would follow the standard eligibility rules just like everybody else and be potentially subject to SNAP's work requirement. So these student exemptions across the top line are all of the places states have flexibility to improve access to SNAP for students. The first one, under the Temporary Assistance for Needy Family Program, basically means that if a student is already eligible for or receiving TANF, cash assistance, they automatically meet the eligibility requirement for SNAP. This is what we call categorical eligibility. Or if they're participating in a state or federally funded work study program. If they're in school through a state or federally approved employment and training program, they meet this exemption criteria. And the reason this is so important for Virginia is because Virginia actually has a lot of flexibility to identify what programs fall under that federal definition of an employment and training program, as well as students who meet the 20-hour-a-week work requirement exemption. States have flexibility here because SNAP says you can average those work hours over a week, you can average those work hours over a month, or you can even average those work hours over a semester, which is particularly important for students who are both enrolled and trying to attend school as well as work, because they often have unpredictable schedules or jobs in the gig economy or fluctuations due to seasonal employment. So averaging those work hours across a longer time period smooths that effect. So they don't look temporarily more wealthy or have more income in December versus January, where seasonal employment typically falls off pretty steeply. Okay, and we see that in Virginia, the State Council of Higher Education provides this phenomenal dashboard using a couple of different data sets to estimate who are all of the potentially eligible students in the Commonwealth. These are undergraduates among public 2- and 4-year institutions that could be receiving SNAP, and who is actually receiving SNAP based on the data that we have, either across the academic year, or even for one semester. And what we have found is that only about 20% of students that could potentially be accessing SNAP are able to access the program, whether it's because they don't know about it or they don't think they're eligible, or the barriers and burdens to applying are just too great. And even though this data is a little bit older based on when Chev is able to combine these data sets for this longitudinal data system, and I'm pretty sure Virginia is one of the only states that actually has this dashboard, we see similar results in our Hope Center research. As I mentioned, the Hope Center is probably best known for our national survey of undergraduate and graduate students at 2- and 4-year institutions. We use this as a tool to reshape institutions' practices and to inform policy change. And in addition to our annual survey, we implemented a survey in May of 2020, right at the onset of the pandemic, to try to understand how students were faring due to COVID-19. And this was completed by over 38,000 students, and you see the other mix of data points there. And what we found was that students at both 2- and 4-year institution were facing basic needs insecurity at almost 60%, which is much higher than we see in our normal non-pandemic survey results. So basic needs insecurity is generally defined as if a student is housing insecure, and housing insecurity includes unsafe or stable housing, couch surfing, a whole bunch of different mechanisms, and food insecure, as well as homeless. So you can see here just at 2-year institutions, almost 36% of 2-year students were facing housing insecurity, 44% were facing food insecurity, and 11% were actually facing homelessness. That survey also found that about 14% of students at the very day and time that they took that survey did not feel safe in the housing that they were in. And when we look at the rates of basic needs insecurity across 4-year institutions, we normally see during non-pandemic times that students at 2-year institutions face worse basic needs insecurity. And we've seen a change during the pandemic, and we think this is largely due to the loss of housing, either in the community where a student was attending a 4-year institution or on-campus housing. This also has serious equity implications, student basic needs insecurity, as well as basic needs insecurity and poverty across the country. We know that systemic and individual racism, such as discrimination in educational and employment opportunities, access to financial products that include mortgages, insurance, and as criminal justice practices, have obstructed the ability of families of color to build wealth, to own homes, and to pass on that wealth to their children, which also affects their ability to support their children going to college. One of the best examples in federal policy comes from the National Housing Act of 1934. This act openly denied federal backing for home loans to Black families while helping low-income whites. And this difference in rates of home ownership and the value of homes has been cited as one of the largest contributors to the racial wealth gap. We really think this context is important when we're talking about disproportionate outcomes for communities of color, because these outcomes do not occur in a vacuum. So when we talk about basic needs insecurity and the effect of systemic racism, this is why we're seeing such a disparity in the experiences of white students versus African American or Black students. In our fall 2019 survey, we saw a 16 percentage point disparity in the basic needs insecurity rates of white versus Black students. And this basic needs insecurity rate only became worse during the pandemic, increasing to a 19 percentage point disparity. When we think about the programs and supports that students have access to, we think about these federal programs and have found that students don't access them at very high rates for a variety of reasons. They didn't think that was available to them or that they were eligible. They didn't actually even know the program existed, or they weren't sure how to apply. Certainly stigma is a factor, and we can definitely talk more about that. But these are some of the reasons that we're seeing students facing such high challenges, and why at the Hope Center we talk about all of the benefits that a student could potentially have access to that could support their college attainment. On the left side of this chart, you will see all of the things we think of as traditional higher education supports. And at the Hope Center, we talk about including public benefit programs to support students' basic needs as a completion strategy. This is part of a comprehensive student aid approach, and really ensures that students have the basic needs support to persist and complete in their education. I'm not going to go through this incredibly text-heavy chart. I just wanted to show it as an example. I'm happy to make these slides available to participants after the session. But these are all of the major federal public benefit programs that we think about collectively as the safety net. On the right-hand side, what we see are all of the student eligibility criteria that restrict students' access to these programs. And I said I was going to slow down, but it looks like I'm running low on time. So the case study example that we have comes through House Bill 1820 that was introduced by Delegate Dan Helmer of Virginia's 40th. The really important thing that this accomplishes is it provides critical food assistance for millions of Virginian residents. It's going to support the educational attainment of the Commonwealth's workforce, and it's going to generate hundreds of $millions in economic activity for the state, with the vast majority of it being federal dollars. I'm pleased to share that just this morning, this bill has already gone through the lower chamber and passed through the Senate Finance Committee this morning on a unanimous vote, which means it's going to go on an uncontested agenda on the Senate floor, and we expect full passage. The other reason this is wonderful is because Governor Northam has made food insecurity a top priority and included this particular provision that we call broad-based categorical eligibility in his budget. And the governor and the Secretary of Education, Secretary Carney's office, also supported the bill as it moved through the assembly. So HB 1820 raises the gross income limit in SNAP to allow families and students to access it as their income grows. And it also maximizes state flexibility in the student SNAP rules. What does that actually mean in practice? So remember this 3-parent family I used as an example before? So previously at 130% of the federal poverty level, they lost their SNAP benefits when they hit this $28,000 annually income limit. At 200% of the federal poverty level, which HB 1820 accomplishes, their income can go all the way up to about $43,000 a year. And during this time, as this family's income is increasing, their SNAP benefit is actually slowly decreasing. So this gradual phase out actually better supports income growth in families as they move towards economic stability, as opposed to when a very small raise results in a total loss of benefits, which we call the cliff effect, and can actually leave a family or a benefit recipient worse off than they were before the raise. So I will just say really quickly, we see a ton of other opportunities for the Commonwealth on the horizon to do similar things. And that, these types of opportunities really do maximize federal and state funding streams, educational outcomes, and state higher education attainment goals. It strengthens the future workforce, and it reduces student unmet financial need. And in the spring, we are going to have the Hope Center's next iteration of our Real College Survey, which includes data from 195,000 students. And we'll also have a special report that is just on the Virginia Community College system, who participated in the fall, about student basic needs and security in the Commonwealth. So thank you very much. I'm happy to answer any questions.
Excellent. With that, we'll open the floor for questions. We're not a huge group, so I hope we can get to everyone's questions, but feel free to post them in the chat, and we'll try to answer as many as possible. Katie shared, I've noticed the effects of having such high criteria for poor students on UVA grounds locally. The community has been moving towards student organized mutual aid groups to meet emergency needs when it comes to basic needs like food and housing, right? So they don't feel supported by the institutional framework and their self-organizing mutual aid networks. Carrie, can you speak to that?
I'm great to hear that the students are sort of taking the onus of making sure that their community is being supported. It's unfortunate that it's necessary. I think what we've really faced is, as the cost of higher education has increased due to federal and state disinvestment, our, safety net in this country has continued to erode. Access to the programs and the ability of students and people, writ large to be able to access the programs has only gone down. So what we've really effectively done is created a poverty trap for low-income people who would like to, break their own poverty cycle, as I tried to do. It took me 11 years to get my bachelor's degree as a young low-income single parent who is a first-generation college graduate. And these rules and public benefit programs are actually a disincentive to continue that education. And these policies really aren't serving anybody. We know that the vast majority of 95% of jobs created coming out of the Great Recession required some form of post-secondary credential. And 65% of all jobs in the future are going to require some form of post-secondary credential. So these restrictions on post-secondary education and our public benefit and safety net programs are really a hindrance, not only to students, but to really, the national economic security and state workforces. I also see part of this problem that we see a lot in institutions is, we have this higher education model that was predicated on sort of these white normative beliefs, white middle class normative beliefs about what a college student is or should look like, right? You graduate from high school, you go to college right afterwards, you attend college, and then you have a little bit of a career, and you find your partner, and you have exactly 2.5 children and a golden retriever, and this perception about the right way to get to college, and these, beliefs about who should be supported or served under this framework of beliefs about deservingness and about college students contribute to why we see some of the barriers in the higher education system that we do. And this really just hasn't evolved to meet the needs of students. It's actually less than 40% of students today meet this traditional framework, meet this criteria of like a traditional student. So we've got, a basic needs, a safety net that's restricting education. And then we've got a higher education system that thinks it's still serving less than 40% of students. And this sort of confluence of issues is creating barriers for, students, the economy, states, communities. It's you pick, you name. It's problematic. And it's really actually a waste of federal and state resources. What sense does it make to restrict people to low wage work and actually get in their way of their ability to attain a college degree? Like, this is, we know these rules are rooted in racist, deficit-based narratives about communities of color, and particularly women of color. Reagan did a really good job with the welfare queen narrative of, villainizing low-income women of color and using that to institute restrictions in the safety net programs, which we still see harming communities and communities of color to today. Sorry, getting off my soapbox and rant.
Yeah, no, this is a powerful point to be raising. That thank you for being so candid about it. Maria, I'm sorry if I mispronounced that. Asked in the chat, our agency is looking to address conservation practices in a very specific watershed that has a community college right in the middle of it. As I'm looking to evolve in our programming, would you think there's a need to connect food insecurity and food education with community college students? I want to provide a service for them by outreach, but I'm wondering if this is something that is of importance to them. Okay, what would be your reaction to that?
So this question came up last time too, and I think the question is, there's a two-part question here. Is there an importance of when you're working in communities to try to find all of the sort of ripple effect of who you're trying to serve and who's going to benefit from those things? I think generally, yes, always, to the degree that you could be more inclusive and, respectful of the communities that are already there. That's always encouraged approach, particularly what we know about environmental justice and, how communities of color are disproportionately affected by things like, climate change and, pollution practices and, where facilities are placed closer to communities of color. So I think it is particularly important. And I'm always going to be the one who says you should always talk about SNAP. You should always bring up SNAP. You should always connect food assistance as much as possible. The Virginia higher education and community college systems are already doing a lot of different things, including participating in our survey to try to address some of these things. But, what it really boils down to is that we need to be treating SNAP and other safety net programs just like unemployment insurance. It's a taxpayer funded benefit. It's there for people who need it when they need it, and ensuring people know that this is a benefit that's provided to you just by the sheer virtue of, being somebody in need is something we should always try to promote and encourage. Not sure if that answered the question, but. Happy to clarify, but yes to all of that. Was to make a short story long, yes to your question.
And certainly in equitable collaboration, our recommendation is always to start by asking, not in the sense of uninformed, educate me on what you do, but in the sense of you're a stakeholder in this community. What do you need? What is, you have expertise, you have that knowledge. So in a community college, which department do you recommend we reach out to them? This gets a little bit to something we discussed in the first round, that a lot of times the structures for accessing this help can be convoluted, can be complicated for folks to navigate, and even as an outside participant might not be totally obvious where to go. What would be your recommendation, Carrie?
So we did talk about this a little bit on the last session, and one of the things that I just want to flag is we appreciate that higher education institutions are continuing to be asked to do more and more with less resources. So I just want to, do some level setting there, that it's difficult to continue to, what's the term? Squeeze blood from a turnip? From a stone? I don't know. So, we think that there are a lot of innovative ways that institutions could approach this. Institutions could look at combining and centralizing student services and including basic needs supports within those services. So this really means, for example, at Delgado Community College in New Orleans, where we did some technical assistance work, they literally have one building where all of their student services exist. So they kind of looked at, what are we spending? How can we, align some of this funding, and how can we include supportive services and make it as easy as possible for students? So financial aid, academic advising, counseling, basic needs support, emergency aids, all in one building. A student just has to go to one place to be able to access all of those. So institutions can think creatively about, what can we do with our existing constraint and resources? And then there are, who can institutions partner with? So Virginia is what we call a county administered state, which means counties actually have quite a bit of flexibility in how they administer programs like SNAP. And for example, in Colorado, which is also a county administered state, we worked with an institution that partnered with our local human services office, who actually sent a caseworker on campus once a week to help students enroll in SNAP and troubleshoot their applications and answer their eligibility questions. There is also an organization called Single Stop, which is a nonprofit that exists on some of the Virginia college campuses. Not sure exactly which ones, but this is an independent nonprofit who comes in and provides all of those supportive services: benefit screening, benefits access, eligibility, connecting to community resources. It often includes the campus food pantry or establishing a food pantry if there isn't one. And it also really is a matter of, how do we continue to get federal and state policymakers to invest in higher education, as opposed to continuing to think of this as flexible funds and pulling back on higher education funding when the economy has a challenge.
I have a participant who has a chapter of One Stop.
You are more than welcome to talk about your One Stop program. I'm sure the participants on here would be happy to hear you talk about that. It's incredibly relevant.
Hello, everyone. I'm Brian. I'm the one with BAD 965. I'm at that particular one. We have, if you go to Reynolds Community College and just go do a search for One Stop, we have a website. And while I'm not as involved in it right now, I'd like to become more involved. One of the things that we've done since the pandemic is we're really tethered to each other now and to the students, both as coworkers and as students, through technology. And so one of the things that we're doing is making sure that everyone has access to technology so they can go to school in the first place. So we've lent students computers. We're allowing people to use computers through our libraries as well. Also, we have opened up, while we don't let people just have the run-of-the-mill in our buildings, for students who are having financial issues and other sort of issues with internet access because of the tethering to the through technology, we're using our campus as one big hotspot. So students can just come and drive up to our any of our parking lots and use our parking lots for free as a hotspot to use the internet as well. And we have maps and things like that for them. We also have offer some financial assistance to students as well. And as you said, we also have a food pantry, as you mentioned as well. So, thank you.
Thank you so much. That's such a fantastic example. I really appreciate it. I encourage anyone else who has ideas about how they're supporting students or things they've heard about how to support students to share. I'm completely welcome to open this up for a broader discussion.
Yeah, we have about a little bit under 5 minutes left for this conversation, so certainly have time to hear from all of you and your work. Also, just as you're thinking through this, what are sort of elements that connect to our framework of equitable collaboration and the work that Carrie has presented about? How might you take that on in your work? What's a lesson you might be able to take away from the Hope Center's work? Katie had another question in the chat. How often have you seen healthcare and or mental health support costs factored into student basic needs support system?
Rarely, if ever, which is something we're certainly working on at the Hope Center. We've done a lot more. Our Real College During the Pandemic report that I showed some data over from May 2020 includes some information about how students' mental health is faring. It's not great, obviously. And then our Real College survey that's getting ready to come out will have additional data on mental health, and we'll have a dedicated report on student mental health later this year. So I only have some vague details about that, so I'm not trying to be cagey. I just don't have all that information right now. What we often see is, thankfully, Virginia expanded Medicaid. So in terms of like policy solutions, this is one of the first things that we recommend. And then you get into the second barrier is states that want to institute work requirements in their Medicaid programs. So I believe Virginia was one of those states that almost implemented work requirements, and just sort of where the status of that is the courts have struck down work requirements as not lawful. And that's actually before the Supreme Court right now. So they're currently not in place, but as a policy advocacy tool, we need to continue to make sure that that work requirements aren't included for someone to be able to just access their basic health generally, and that they're certainly not restricted for students. The other thing that I would add is when we're talking to institutions about mental health, we ask them, do you know if your campus healthcare provider or your clinic or whatever accepts Medicaid? And oftentimes we find out that they don't. They have a fee-based scale, which isn't necessarily all that generous, but it's because of the challenges registering as a Medicaid provider through the federal government that it's like a very large administrative burden. And then I've also heard about some challenges with the community college system in Virginia not being reticent to provide mental health supports and connect students to mental health supports, which is a conversation that's actually happening in the Commonwealth right now, and something that we continue to look at as an advocacy tool to expand mental health supports. But one of the things that you're flagging, I think, is we do not accurately capture what a student's actual cost of attendance is, what their price of attendance is. And this misnomer that their living expenses are not a part of their cost of attendance is based in that normative perception of who college students are, right? Probably getting support from their parents, so we really shouldn't factor in living expenses that much. And so, these calcified perspectives that we have about students and, about what they need to be successful and be supportive are contributing to these problems.
Excellent. We're almost at time. Please join me in thanking our presenter. Thanks everyone who was
Thank you so
participating.
Thank you for coming and engaging. I really appreciate it.